International Youth Day is observed every year on the 12th of August. Since 1999, to commemorate the potentiality, strength, and initiatives of youth all around the globe. In Bhutan, International Youth Day was first celebrated in 2009 and was conducted by Youth Center Division, Department of Youth and Sports. The day aims at encouraging youth around the world to organize activities to raise awareness about the situation and requirements of youth in their country. This year, we are celebrating the International Youth Day at Harmony, the Centenary Youth Village in Thimphu, with the theme Youth and Mental Health. We aim to bring youth and officials from different youth-related agencies together to understand about mental health issues of young people in Bhutan.
Today, we have a series of interesting activities lined up for all to take part in. Report presentation on mental health survey that has been done by the HIV volunteer. We have informative talks by various youth groups, panel discussion by our HIV group, and you may ask any queries or questions, and other fun and interesting along the day to keep you informed, engaged, and interested. I welcome all to take part and have a wonderful, fun-filled International Youth Day 2014. Thank you very much.
I have seen that many young people are now coming with lots of distress, and the most common problem that I see is anxiety among the young adults, and there are many other things. Now, since mental health and mental illnesses are very commonly sort of mistaken concept, I thought I would just take this opportunity to educate people, the young people especially, what it means by mental health and what it means by mental illness. Because sometimes whenever we talk about mental health, it is taken as a negative connotation. Now, mental health is not negative. Mental health is the health of the mind. So with this, I will begin my presentation. Mental illness is actually characterized by many things, among them thinking. So there will be alternation in the thinking, emotion or the behavior, and it is also associated with personal distress and or impaired functioning. So like other illnesses, mental illnesses are also the result of a complex interaction actually between biological, psychological and social factors. Sometimes we tend to believe that mental illness does not have all those things, but they do have a linkage between all these factors. Now obviously, all of us think, all of us have emotions, but then when do we draw a line and say that I could be having a mental disorder and I may not be having a disorder? So the main feature is the recurrent changes in one's thinking, feeling, memory, perception, and judgment, resulting in abnormalities in thought and behavior. So whenever there is changes in our thoughts, it shows in our speech, it shows in our behavior. Like for example, a person who has a thought disorder. Now, thought disorders is a type of disorder in which a person becomes psychotic and the person starts thinking in a certain manner which is actually disturbed. So, a person starts thinking that people are after him or his life is at danger. So how would he behave? Obviously, he will be very suspicious. He may keep on closing the door. He might simply withdraw from the society. That sort of a behavior. Now, if this comes recurrently and for a long duration of time, then that is the time when we might have to evaluate and find out what the person is suffering. Now, all of us come through difficult times in our life. Sometimes we can be affected by certain events and we feel sad. Now, these are normal emotions. So we don't call it a disorder. As long as it is not affecting our day-to-day activity, it is not affecting our behavior and thought, and we are not withdrawing from the society. But if the same feeling persists for a very long time, then it becomes a disorder. Now, even when somebody loses a dear one through death, now there is a normal period of bereavement all of us go through. But then, sometimes we bereave for a very long time. Then it becomes a disorder. Now, common symptoms of mental illnesses can be changes in the bodily functions such as sleep. Now, a normal individual needs rest. The rest of the body is okay. The need for the rest of our mind is very important. Sometimes we tend to put too much effort. We don't sleep. We want to do best in the classes and we keep on studying. Is that going to help you? Because sleep is a very important thing. 7 to 8 hours of sleep is very important for us. And if somebody is not putting that, obviously the mind is not rested. Therefore, it is very difficult for that person to function subsequently. And then they will project that in the form of distress. Now, appetite. Now, another thing is a normal, healthy individual has a good appetite, and we are supposed to eat certain type of nutritious food in certain times of the day. All of us know that. But then, if you suddenly see that either your appetite is gone down or it has gone up, both way it is abnormal. So we have to think about that. And sometimes weight, like when your appetite goes down, obviously your weight can fall, or if your appetite goes up, your weight can be increased. So usually the patient will lose weight because of poor appetite, but sometimes people, even when they are depressed, they tend to eat a lot under depression and they can have excessive weight. Sometimes even our medication sometimes can put weight on people, so sometimes we caution them about that. And then the appearance, this is very important. Like whenever we try to sort of give a diagnosis for psychiatric disorder or mental disorder, we don't have any devices to find out who is suffering from mental disorder or not. So we take certain parameters into picture and then try to find out whether this person may be suffering or not. Now, appearance, for example, for a person, like sometimes appearance is basically subjective. Now, a person, for example, who works in an office, he is an officer, he has to dress in certain manner, he has to wear a robe with lage and whatever, and shoes, all that thing. And suddenly one fine day you see this guy not wearing all this thing and entering into the zone. So obviously there is something wrong. So that is what is the appearance. Sometimes your appearance can say a lot. But the same, if it is the same person from a village who perhaps doesn't have shoes or whatever, then for him that is the normal appearance. So we have to see that and then say. So appearance will tell a lot about a person. Like we basically express our emotions through different body language, through different behavior and all. So our emotions are seen on our face. Now sometimes if somebody is having a mental illness, then the emotion can be erratic. Where a person is supposed to cry, the person might just laugh. Or when he is expected to be quiet, he starts dancing. So there are changes there. And similarly, perception. Now, perception is what we perceive through our five senses. When we have a stimulus, we perceive. That's the normal phenomenon. But the moment we perceive something that is not there, then it becomes a hallucination. So a person can have hallucination when somebody's thought is disturbed, like especially people who are suffering from psychosis, or people even withdrawing from alcohol or under intoxication with drug and alcohol. Now thinking. Now it is very difficult for somebody to actually analyze a person's thinking. What somebody thinks is not evident to other people. What I think cannot be read by another person. But sometimes people who suffer from very serious type of mental disorder think that their thoughts are either taken out or somebody is putting thoughts inside their mind. It sounds a little funny here, but it does happen to people who are suffering from some chronic psychotic disorder. So we have to think about that. Like thought, and then sometimes they also feel that their thoughts are being read by another person. So that is what is thinking and level of consciousness. Now we all are conscious. That's the reason why we are here. But sometimes we can lose our consciousness and we may not know where we are, who we are with, what time of the day it is, what day it is, all that thing. So we lose our consciousness, and sometimes the next is memory. Even memory gets affected by certain mental disorders, and then our attention and concentration. Now, the most common problem that I was saying among the youth is anxiety. Now, when you are anxious, like if we are not anxious, let's say, if we are not anxious, our input on our work as students will not be good. If you are not worried about anything, not passing, nothing, then we don't work. So that's why there is something called eustress. Some stress is required for us to perform well everywhere. If I am given a deadline and if I am just relaxing and I don't do my job, then I don't perform well. But then if I am anxious, I do my job well. But the same anxiety, if it is beyond certain limit, then we tend to make mistakes. And that time we tend to lose attention and our concentration, and instead of doing well, we'll fail. So this is what happens. And sometimes the anxiety becomes so overwhelming that you don't know how to handle it, and that is the time when we have seen a lot of young people just fainting, or they are breathing so fast, hyperventilating. So 10-15 people carrying them to the hospital emergency room. So that is what is the most common type of presentation we see. The other thing is just a week ago, I think some students from a remote place somewhere in Tashigang area had gone to seek blessing somewhere, and then on the way back, they had gone to a big lama who was giving wang, and then on the way back, one guy saw a spirit or bhoot or whatever you call it, and then suddenly all 7 or 8 of them who were in the group started seeing the same type of thing, because when somebody sees something, he starts describing this, and then the description will be immediately captured by our imaginative mind, and it goes inside our psyche, and we start seeing the same thing. So the doctor calls me from Tashigang. He's saying that there's this type of problem. So this is what is called mass hysteria. Now there is a term called hysteria. Now it doesn't mean that, like many people believe, that hysteria is a condition where girls are like sort of having problem with their sex or whatever. It is not so. Hysteria is simply excessive anxiety and fear. So here there was hysteria, so I told him to manage that way. I don't know what has happened. And the similar thing had happened a few years ago at Buisu, where we had to take the help of the local lama. Sometimes our cultural practices are very good, sometimes if we can complement. So the lama came, they performed puja, they did this spirit chasing thing with stones and pebbles and all, and then finally everything got all right. We didn't have to do much of interference. Now, unfortunately, the present practice is to believe that everybody is equally intelligent. So we want our children to perform as good as the other guy. So we'll keep on comparing them. Why are you not studying? He's getting so much, 80%, 90%, 100%, and you are getting just 60%. But then our intelligence is also like our muscle strength. All of us cannot lift the same weight, otherwise we wouldn't have this Nyage competition, no? People are doing Nyage competition. We cannot compete there, carrying those big tires and I don't know what not. So similarly, every student will not be able to do the same mental work. So that's the reason why people have different capabilities. People are now placed in different ways. So it doesn't mean that just because you are not performing well now in school, you will not be the best person. Who knows? One fine day you may be a very rich person. You may be having a different intellectual quality to do something different. So intelligence is very important, and in order for that we have to realize how we can actually find out how intelligent we are, how much we should put in our effort to work in the school and in our studies, that sort of thing. The other thing is called insight and judgment. This is very important because sometimes even when we think that we could be suffering from a mental disorder, sometimes we don't realize that we could be having a mental disorder. That's why we say we don't have insight. Now, another thing that changes when somebody is suffering from mental illness is the personal hygiene, social activities and functioning. Now, like I was mentioning about the personal hygiene, sometimes people suddenly start neglecting their personal hygiene. A person who is always seen to be clean, shaven and all, starts growing a big beard. He's not even combing his hair. He's keeping his clothes dirty. All that thing can sometimes point towards a diagnosis of mental disorder. So we have to be a little careful when we see these type of changes among our siblings, among our children, among somebody whom we know. And social functioning. Now, normally everybody likes to socialize. They want to be in a group, they want to play, they want to dance, they want to sing, they want to do so many things. But suddenly you see that a person is withdrawn inside the house. For him, going out becomes a difficult task. For him to socialize becomes a big activity or a very difficult activity. So that is when we suspect or have some problem. So, and functioning, obviously, like our own responsibility, if you are not able to carry out those responsibilities, that can point towards the diagnosis of. Next one. Now, many times people ask me what are the causes. It's very difficult. I think even after such a long time, we have not been able to really come to a very conclusive sort of causative factors for mental illness, like for many other illnesses. So there are different theories, and they say that genetic is one component. So if we have somebody who had mental illness in our family, in our mother's side or father's side, we can have a higher chance of getting a disease. Now we have got these new MRI machines where they also try to see the functioning of the brain. So through that, they have now found out that there are some physiological changes or physical changes in the brain, and there are some physiological changes that can also affect. And then obviously they also talk about chemicals, like there are lots of chemicals that also chemical changes that place in our brain. which causes mental illness. Next. Now there are environmental factors. Sometimes we have a gene to become mentally ill, yet we are perfectly fine as long as our environment is good. Now suddenly, if the environment changes, for example, there is lots of noise, war goes on, people are unrest, lots of riots happening and all. So sometimes we can become stressed out and then we can have these symptoms. And sometimes the childhood experiences are also considered factors for having mental disorders, such as lack of parental love. Nowadays we see a lot of parents getting divorced, so that can sometimes affect a child's mental health, and then they can suffer from different types of mental illness. Or there is lack of guidance during childhood, or there were some very severe psychological trauma during childhood, like rape or physical abuse or sexual abuse, those type of things. And then the home atmosphere. Now this is very important component, because home atmosphere, that is where our children after the school sort of spend. So at home, if the other members of the family are in conflict all the time, there's quarrel, gambling, drinking, whatever happening in the home environment, that can also affect a person's mental status, and then they can show mental illnesses. See, as we progressed, we learned only one thing. We learned only to get a degree certificate. Beyond that, I think many people have not learned any other skills. So the main intention for them is to get a job. Now if there is no job, obviously you feel hopeless or helpless. You don't know what to do because you don't have any other skills. So that is what I think is pushing most of these young people into either depression or anxiety, along with alcohol and substance use disorder. Like during our time when we were younger, we also learned certain other things. Like we knew how to take care of the cattle, we knew how to collect firewood, we knew how to plow the field, we knew so many things. Actually, I also learned how to weave baskets. I still know perhaps. If I do it, I can do it now. But then these skills are not passed on to our younger generation because they are not any more sort of useful also. Like you are in a city where you are not doing it, so obviously your children will not learn it. The only thing they know is your father goes to the office, comes back in the evening, or your mother goes to the office, comes back in the evening. So they also want to do the same thing, carry a fire, go to the office, come back in the evening, and you are having beer or ara or whatever in the evening. So they would also like to do the same thing. So obviously, I think the skills that they require in order to live independently has not gone there. So that is what my feeling is. Since I got an opportunity, I'm just mentioning this. And then chronic illnesses sometimes can be a predisposition for mental illnesses. Like somebody suffers from diabetes or severe hypertension or cancer, AIDS, all these things can sometimes make a person feel hopeless, helpless, and sometimes even they can commit suicide. Like sometimes we can have our own problem. Like sometimes we feel that we are too thin or too fat. So these are like our own self-image, or lack of confidence, lack of skills, or like you don't have any social skills to resolve conflict. So all these things can sometimes cause mental illness. So all in all, like now we know what is mental health and mental illness. So as I mentioned in between, that yes, we do have problem among the young people. Now it is high time for us to learn certain skills in order to manage these stresses. Fainting is not going to help because it's going to make you worse. Now it has become almost a mandatory thing for me to say that okay, this guy is severely mentally stressed. can you please excuse him from not appearing exams or something like that. I know that they are suffering, what to do? I have to do it now. So it is becoming a big issue. So mind your mind for this year. Okay? And then youth and mental health under the slogan Mental Health Matters. Youth with mental health conditions can often experience stigma. Now this is a big problem. When they come and seek help from a mental health professional, sometimes people are labeled as psycho. For psychosis. So that is what is now. We have to break this. We have to break this stigma. We have to seek help in time. We have to take treatment for it. And then just because you visit a mental health worker doesn't mean that you are a psycho. Psychosis is a condition, and it is only 1% of the total population suffer from psychosis. Rest of the conditions are as simple as not sleeping well for one week together or things like that. I am requesting you, all young people, to kindly come forward and seek help whenever you think you are going through some sort of a mental illness. And as youth, you have the responsibilities. You have to be part of it. Not one person can handle all this. Or not, it is not only the responsibility of the mental health program, but it is the responsibility of all of us to dispel this discrimination, the myth, and all these associated mental health and mental illness. Thank you. With this, I conclude.
And this year's theme is aimed at raising awareness on the need to reduce stigma on the youth with mental conditions. This is because mental health conditions affect the development of the youth socially and economically. Youth with mental health conditions can experience stigma and discrimination, which would discourage them from seeking help. In keeping with the theme, a group of us belonging to the Harmony Youth Support Group, under the guidance of the Youth Center Division and Dr. Nirula, set out to conduct a small survey in Thimphu to see the mental health condition of the youth. We had several meetings in the Youth Center prior to the survey where we discussed group formation and areas to survey. Dr. Nirula also gave us skill formation to administer the questionnaire. 6 groups comprising of 5 to 8 were formed, and we conducted the survey over the weekend. We targeted schools and places where youth usually hang out. The actual findings will be discussed in a panel discussion that is to follow. Even though the sample size is small, there is a lot of information which will be studied in depth at a later stage. For me personally, it was an educative experience as my social skills were enhanced. Thank you very much for the attention and hope you have a great day ahead. Thank you.
You must have gone through the questionnaires, and were you already meeting people with a certain level of discomfort yourselves?
When we went on survey, some people were having misconception of the theme mental health. So they were saying that, sorry, we don't have any disease called mentally health or something. And after we explained the whole questionnaires, they were so confident and cooperative that they even had some jokes and all. So we had a very interesting journey. And through this journey, we went to the different places, asking them questions, and there were some sensitive questions where they didn't want to answer.
Papers.
We were around them because we thought that they will need help with some questions if they don't understand. So we'll have to help them and explain the questions about what it really is and let them get the right concept of the question, not that the negative point.
We decide where to go and what to do with our life. And I think it's very difficult to decide what to do with life. At youth period is the time to decide. So maybe they come in society not knowing what to do and they're not getting what they want or what they need and they're losing hope of themselves.
And it's written that an overwhelming 56%, which is 188 of the 188 who filled the questionnaire completely, had consumed alcohol. 30% are 24 years old, 25% being 22 years old, and 23% being in the age of 17 and 18 years. I think this was quite a discovery for me, and I think further on when I was reading it, 35% responded that they had had alcohol on special occasions, 10% had experimented, and 74% were regular drinkers, and we're talking about teenagers here. And 68% of the 35, 24 years. But then there is, okay, I don't have the teenagers themselves, the majority are male, 20% who experimented were females. But then again, I was told that perhaps the women were not too honest, the females were not too honest. And I'm beginning to understand why, because if y'all were around, even I would have not written anything down truthfully, knowing that somebody's watching over my shoulder. But then, what are the instances then came out to you? For instance, you said your eyes directly went to the question where it was about alcohol. What about you, Sunam?
Because as children know that it is related to sexual intercourse. So when we interview with monks and nuns, I was feeling uncomfortable to ask questions to them. Who knows? They may be telling that. To be honest, all are interested in sexual intercourse.
All are interested? I think that's the assumption. Any of you now, who said this very, I really thank you for your honesty, by the way, Sonam. What were you like when you got the papers in your hand first? And what were you like after the questionnaires were filled and you received quite a number, and you had met quite a number of respondents? Anybody would like to answer that? Jamia? Surprised that people would actually give this information about themselves. I mean, of course, it was supposed to be anonymous, and you were not asking people their names, but what were your expectations when you went out with these questionnaires?
At the beginning, it was quite tough to go around and meet with new faces and tell them, please fill out the questions. That also, it was all directed towards the mental health problems. So it was quite tough at the first place, but later the respondents we met were quite cooperative. So
one of the limitations of the survey was that it had only 180 respondents, and it may not be representative of the Thimphu populace, but I think it's safe to say that this is quite representative of the urban youth population if you were to look at the areas that you actually visited. It's, I think, in a way quite significant because you found quite a few people to actually fill your questionnaires. Another thing that stood out for me was really about how eating disorder seems quite pervasive among the urban population, especially among girls.